Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Although largely underappreciated, periodontal disease is emerging as a significant risk factor for the development of heart failure. Now, to this end, the Journal of the American College of Cardiology published the results of a large research study in 2022 that showed a strong correlation between periodontal disease and risk of heart failure. Now, the researchers followed almost 7,000 participants aged 63 on average from the year 1996 to 2018 as part of the Atherosclerosis Risk and Community Study. As the researchers point out, previous studies have shown a strong correlation between periodontal disease and risk of coronary artery disease, ischemic stroke, adverse cardiovascular outcomes, and/or diabetes. But the 2022 study showed convincing evidence that heart failure risk is also increased substantially in the presence of periodontal disease. As the researchers commented, heart failure is already increasing at an alarming rate in our society due to the aging population, coupled with the rising incidence of diabetes, obesity, and metabolic syndrome. In the United States, it's estimated that over 8 million people will be living with heart failure by the year 2030. And making matters worse is the fact that medical treatment for heart failure has not substantially improved in many years, whereby 50% of heart failure patients still die within 5 years after the diagnosis. So it becomes critically important to prevent congestive heart failure and heart failure of any kind. So where does periodontal disease fit into the story? Well, the 2022 study showed that not only do subjects with periodontal disease have a higher risk for developing heart failure, but they also have higher blood levels of the key indicator that suggests that heart failure is present, which is the NT-proBNP blood marker. Periodontal disease is a condition characterized by destruction of tooth-supporting tissues and subgingival microbial dysbiosis. That means that there's gum disease and there's a lot of bacteria in the gum lining. So previous studies have shown a link between gut dysbiosis and leaky gut problems and risk of heart failure. Now, dysbiosis means that you have too many unfriendly or pathogenic or harmful bacteria in your gut and too few friendly bacteria in your gut, health-promoting bacteria. So you have the balance is out of sync. You have too many unfriendly bacteria, not enough friendly bacteria. We call that dysbiosis. And if you have a leaky gut, it allows more bacteria to enter the bloodstream, which triggers an inflammatory response that can damage the heart and the vascular system. But the 2022 study showed for the first time that dysbiosis in the oral cavity, which is the key finding and cause of periodontal disease, also increases inflammatory markers in the bloodstream that lead to heart failure. In fact, other studies have shown that by successfully treating periodontal disease and reversing oral dysbiosis, markers for inflammation in the bloodstream decrease significantly. Now, certain inflammatory markers are shown to be elevated in heart failure, including interleukin-1, TNF, and CRP. So TNF is tumor necrosis factor, and CRP is C-reactive protein. Let's just call them TNF and CRP. Now, the Framingham Heart Study is one such study that showed a five-year risk of developing heart failure increased by 60 to 68% as these inflammatory markers became elevated. Now, these inflammatory markers are products like interleukin-6, TNF, CRP. They damage the heart by causing death of heart muscle cells. They promote heart hypertrophy, so it enlarges. You get heart fibrosis and stiffness. They also alter the ability of muscle cells to access the calcium they need for the normal pumping action of the heart. The bottom line is that good oral hygiene is an often overlooked factor in the prevention of cardiovascular disease in general, including heart failure, as a 2022 study has shown us. Regular dental checkups and regular visits to your dental hygienist for teeth cleaning, as well as daily at-home dental care, should be a priority over your lifetime as one more step to maintain your cardiovascular health. And keep in mind that supplementation with CoQ10 and hawthorn after the age of 40 or 45 also helps your heart maintain more optimal pumping ability, helping to prevent and co-manage heart failure problems, according to many studies. So like periodontal disease, CoQ10 and hawthorn supplementation are also often overlooked strategies that can help to keep your heart strong and functional. So I've included the reference for the 2022 study on periodontal disease and heart failure in the text below. Thanks for watching, and I'll see you next time.